The meeting of the Health and Education Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus.
Oh. Please don't tell me I have to read that again. You could hear me. Okay, very good. Okay, we've been down this road a few times in the last couple months. So I would accept a motion that we proceed electronically.
So moved, Madam Chairman.
Very good.
Second time.
Very good. Thank you. And when we take this vote, I'll ask that we also count this just as our roll call.
Commissioner Blair?
Yes.
Commissioner Cook?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Chairman Allen?
Yes. Very good. All right, our first order of business is to approve the minutes. I'll entertain a motion.
Madam Chairman, I've reviewed the minutes from the July 28th meeting, find them to be in order, and without objection, I move for their approval.
Very good. Thank you.
Second.
Good.
Commissioner Cook?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Commissioner Blair?
Yes.
Chairman Allen?
Yes. Very good. All right, our first report's Health Department. Ms. Garrett. Welcome. Thank you.
I am here to report the July Health Department report. As you can see, can y'all not hear me? Hello? Can you hear me better? Okay. So I'm here to report on the July Health Department report. I keep hearing an echo. Are y'all hearing that?
I am hearing an echo. I'm not sure. Okay.
Okay.
Just proceed.
Maybe if we could mute everybody.
Yeah, is everybody on Zoom muted? Let's just make sure we're getting a little feedback. Okay.
Okay, let's see. Seems to be gone. So with strict infection control measures, we have started to see patients in the clinic, so our numbers are starting to come back up to closer to where we would expect that they would be. Things that we're doing are having the patients complete history forms and check-in processes in their car with us over the phone. And then they come in and go straight to the doctor or nurse room and have their visit to try to cut down on risk or infection. So that slows things down a little bit, but we're slowly getting back to normal there. We're continuing through federal guidance to have WIC 100% telehealth. So WIC is still, the Women, Infant, Children program is still being done over the phone with our clients. And not only do we continue to meet those numbers for where we were this time last year, but we've had some increases even. More people needing the service or easier to access the service through a telehealth. A little bit of both we've seen. Of course, with back to school, there's been lots of immunization visits and lots of birth certificate visits, things that people need for children to get back to school. We put together a local health department team for response for city schools, for county schools, for MTSU, so that they have direct contact with us 24 hours a day, 7 days a week when they need our advice, our guidance. And we've been working closely with them and their liaisons at the schools, MTSU, city, and county. We're still doing testing for COVID daily through drive-through services. It's 8:30 to noon, Monday through Friday. There is no charge and no restrictions. Anybody who feels they need to be tested, if come in contact or having symptoms, they can come through and get tested. We've perfected this. It's very efficient. Very few minutes you're in line to at any time of the day to get the test completed, and then you're gone. Yes, so right now we're seeing results in about 3 days. So we're still telling people when they come through probably 5 days to be safe, just in case there is any delay or what. But right now we're currently seeing a turnaround of 48 to 72 hours for our results. Let's see, we still do have cloth reusable mask. If anybody needs those in the community, whether it be businesses or personal, you can stop by either health department, Smyrna or Murfreesboro, and pick up mask during our business hours, 8 to 4:30, Monday through Friday. We have continued to see on our data points decreases happening for either both the positivity percentage of people who are positive that are tested and the overall percentage of positive. So over the last 7 days, we've seen an average of 8.5% positive, which is really good. That's a good number to be seen. We want that to continue to even go down even more. 7 days before that, we were at somewhere around 11%. So we're seeing a slow decrease in the percent of positives. We're testing between 250 and 500 people a day at the health department, and in the county we're testing somewhere around 1,000 a day throughout the county. So primary care doctors are doing it, walk-in clinics are doing it now. There's people tested at the hospital who are inpatient, that kind of thing. So overall, we're seeing still a pretty robust testing protocol that's happening in our county.
Commissioner?
There.
The ones that coming through, be tested to the drive-through, do you ask them why?
Yes, we do collect that data for the state. It's submitted every day. So when you come through, we ask what kind of symptoms are you having, and some are none. Some are, I had a close contact, and then some are having symptoms. So we record that down, and it goes to the state.
I was just curious as to the main reason, were they exposed or they felt like they were?
It really seems like a kind of a mix. So we are seeing some that are just kind of worried well. They think maybe they got exposed or they just need it for a trip or whatever. We've got those. But then we have fair share of people who come through with symptoms, some very mild symptoms. There's quite a range of symptoms now, up to 20 different symptoms that can be present when you're looking for COVID. So.
Commissioner Gurley, did you have a question? No, okay. Mayor?
Thank you, Madam Chairman. Ms. Garrett, we had talked right before the meeting, and from the time that I mandated the mask, I've watched Bernard's graph continue to go down. It did bump up I mandated it on the 22nd. It went up maybe 23rd, 24th, just a tad, but those numbers were probably in the rears.
Right, exactly.
Right?
Yeah.
Because it was taking 5 to 10 days back then to get the results. So we've seen a steady decline down the last 2 days. Yesterday was the lowest that we have been since March.
Yes.
And positives. And I was glad to hear that you say that you're still testing robustly, because people are trying to use that as saying, well, they're not testing like they were.
Right.
Our numbers coming down. So
and not only, the raw numbers like you're talking about, but the percent of positives. So no matter how many you're testing, if your percent of positive is going down, then you're still showing a good trend that you want to see, which kind of shows that we need to practice the social distancing, the wearing the mask.
Still
Those
continue.
kinds of tips are what we can do to protect ourselves and to get it under control in our community.
So the governor's mandate expires next week on the 31st. I don't know what he's going to do. He may not continue to renew the mandate. And then I was asked today by another elected official, am I going to renew if whatever the governor does, what am I going to do? And I do that in consultation with the other city mayors. That we try to collectively do everything together. And if you can verify this for me, because I keep hearing it from people after people who say that they have a friend who had a friend, okay?
Yes, sir.
And they were in line.
Right.
And you all went out and wrote their name down, and they got tired of waiting, so they left, and then they get a call a week later and said they tested positive. Are we doing it that way?
Not at all. So I can
Good.
speak
I was so glad to hear
specifically-
that, because everybody had a friend who had a friend, and it became an urban kind of thing.
Exactly. Yes,
Who
sir.
was really disking the process that you had. So you weren't going 2 blocks down the street and getting their name and then coming back up, and then they got tired of waiting.
Right, exactly. Number one, we're not waiting very long. I mean, most people wait less than 5 minutes for the entire process.
I'm glad to hear
right
that.
now. So they're not waiting very long. And I can speak specifically to Rutherford County. So let's say you did do that, and all of a sudden you're like, oh, I got a call, I've got to leave, right? We're just going to shred. It's going to go into the pile of shred, your form.
And so you
that's
won't
the end
follow
of
up with
it.
a phone call?
It's not going to go to the
Gotcha.
next phase, which is entering it in so it goes to the state. And then the lab matches that with the
So like McDonald's, you pull out a line, you're not getting, the next person's not getting your Egg McMuffin.
Right, yes, sir, that's right. I can speak for sure, 100% for Rutherford County Health Department, that is not happening.
That's,
We'll do Commissioner Cook and then Commissioner Gurley.
Is testing done only in Murfreesboro, or is it both health departments?
So right now, we're still just testing in Murfreesboro, and the reason being is Smyrna's parking lot is really tiny, and to get a good drive-through, you need an entrance and an exit. We're blessed in Murfreesboro to have an entrance and an exit. So we've been offering that. There are plenty of primary care. If you have a primary care doctor, you can go there. There's plenty of walk-in clinics at both ends of the county. But to try to set up a drive-through in Smyrna will spread us a little thin, and also very difficult, safety-wise, to get cars in and out. We've even had a couple accidents in Murfreesboro because of trying to get people in and out. So I could only imagine it would be 10 times worse in our Smyrna site. When we did some renovations in Smyrna, we did try to make an exit onto, what's that road?
Rock Springs?
What'd you say?
Rock Springs?
Rock Springs, right. But the city said no, it was too dangerous to have people exiting or entering from Rock Springs. They wanted us to, so they denied that when we wanted to do that during the last renovations that we did.
Commissioner
I
Gurley.
was just going to say, I was at DMV yesterday, mid-morning, and observed the process, just sat there for a few minutes and observed. It looked like cars were going faster than you would get in a McDonald's line. For comparison, it was just a steady stream in one way, loop around and out, and it seemed like it was moving really quickly for something like that. And so
We can do over 800 in that short amount of hours. And I can remember when this all started, we were so proud of ourselves when we did like 70 for the day. We're like, yeah, we really did good.
but I just thought it was, there was no backup on the street. It was it looked to be very efficient, very quick, and so I don't know I really don't know how you could get much faster or more efficient, and not. Well, it's just a very nice layout and seemed like really flowing well.
Thank you for saying that. We worked really hard, and we throw a lot of staff at that to make it as efficient and as possible.
Commissioner Blair.
I don't recall that we talked about budget increase for your department here lately. Mayor, is there going to be some help from the state and federal for all of this legwork being done?
we met with every department head with this new CARE grant. Everything has to be COVID related, so we've asked every one of them to think outside the box and anything that could be. The scary part is that everything has to be purchased, turned in, purchased, and delivered and installed by November the 1st, and then
Yeah, it was December, now it's moved to November.
Yeah, and it's just so
making it
confusing.
hard.
We've got over $4.6 million, and there's no way we can spend that and do what we need to do. I know we've come up with about IT I talked to Cody today, and he's put things together. He's up to about 1.1 million of things, you know, from laptops or people could work at home and those type things. We're going to fall way short. I don't know anybody that.
Smyrna
any other
and
county.
Murfreesboro phones are in that as well. Total new overhaul of phones that will be replaced because we've definitely tested them to the max with getting sometimes as many as 200 calls in a 15-minute.
But they were questioning us. We got a kickback a little bit on your phone system,
system.
which is $300 and something thousand, and every phone call you get, I'm sure it's not about a skunk in Rockville or
Right.
how to get a physical, go to camp or something. It's COVID related, I would assume.
Yes, absolutely. Right now, it definitely is. And then there's some other things we were looking into, too. We're trying to get bids and that kind of stuff. But there's some UV lighting that you can put into your HVAC system that does a lot with helping to keep disease and infection control measures in place. And I really want to get that in both sites. So working on things like that. So they've been working with me to get those tents purchased and things, fans that we needed, Gatorade, little packets to add to water, tons of water. The county showed up with tons of water for us.
The problem is everybody else is thinking the same thing
Yes.
and trying to get the same
The
thing.
same thing, yeah. Ice vest, they loaned us ice vests so that during the real heat, we could have those on underneath our PPE because it's pretty hot out there when you put all that garb on. And I have people working in hour shifts and then taking 15-minute breaks and that kind of thing to protect them.
Know what COVID has cost your department so far?
That's a good question. Because we are a mush of so many different agencies, so we receive federal pass-through dollars, we receive a lot of state. The biggest portion of our budget is paid by the state of Tennessee Department of Health. I mean, I could probably get a number for county purchases, things that we had done that we needed. But then there's the whole thing of staffing and how many hours, like when we put our time in every week, we put how many hours did we work on COVID, how many hours did we do other duties, that kind of thing. And so that's a huge cost, overtime and comp time, those kinds of things that we have to pay out. But almost all of our employees are either state employees or county employees that are reimbursed by the state. We have a handful of what we call pure county employees. So those would be a pure county cost of COVID things.
Dana, has there been any kind of revision, because I've heard there has, on the protocol for quarantine?
Yes, so there was a quarantine change to make the Tennessee Department of Health's guidance match the CDC's guidance. And it only has to deal with household contacts. So if my husband was to test positive for COVID, he would need to do his 10 days of what we call isolation. That's if his symptoms are mild and he's feeling better. He would do his 10 days, and then I am doing 10 days with him in quarantine. So he's isolating, I'm quarantining. And then I would have to do another 14 days after that 10 days. Because every day I'm being exposed in the house to COVID. So if I'm just a contact to you and we don't live together, then I only need to do 14 days from the last time I was around you closer than 6 feet for more than 10 minutes. But if we live together, I've got to do the 10 days with you, the case, and then I have to do 14 days on top of that. Yeah, you could move out to a hotel or other family member's house, and then your 14 days start from the last day you're around the case.
Okay.
So it could be 24 days for household contacts only.
So is there any impact on, like, I'm thinking about like for our school system, when children are sent home because of needing to be quarantined, is there any ripple effect, any impact on that household? Or is it only to that child?
Yeah, so if the child is he kept positive?
Let's say he's not. Let's say he's just quarantined.
Okay, so he's just quarantined. No,
Right.
parents don't have to do anything if he's just being quarantined.
Okay.
Right. I mean, they may need to be there to take care of him.
Right.
But yes,
There's no additional precaution for them, a requirement for them to quarantine?
exactly.
Okay.
Exactly.
And then we're approaching flu season, so when will you have your flu vaccine?
Soon, we should have flu vaccine and flu protocol to start giving that. So we're working on that right now.
Do you
Probably
think
by
that-
next month, I'll have protocol guidelines and times and where you can go and get it. And
Because I know October is kind of the time they want you to get it. I was just curious if we're giving them earlier this year because of this. And also when it gets near the end of the flu season, a lot of times they will waive any sort of payment. I didn't know if now maybe preventatively they're just going to do that on the front end to encourage people to get it. So
It's a good question, and I did send that up to our state Department of Health recently, so I'm still waiting on an answer about the cost, if it would be. I know I worked with both the city and county schools to get a third-party company that's going to come in and offer flu vaccine on site. They're just a little overwhelmed right now to even think about dealing with that, but that's coming down the road, that parents can have that option if they want to have their child vaccinated right there at school. They can. So trying to be proactive on that, because yes, flu season and this converging can be an issue. So we are going to strongly recommend flu shots, and as soon as you can get them, the better. So September, if we can start getting those shots in arms at that point, that's just as good as doing it in October.
right.
Yeah.
And then I know you said the symptoms are kind of all over the place now.
Yes.
Is there any distinguishing feature between the flu and COVID, or is it only going to be by a test?
Difficult. It's going to be difficult to tell. That's a good question. But one thing that we only see in very few disease processes is loss of taste and smell. That's definitely a COVID specialty. There's a few other things, tumors, brain activity, those kinds of things that can do that. But the majority of the time, we don't see that in flu.
Right, okay.
But again, if you don't happen to be one of those people who gets that symptom,
Right.
it's going to be hard. So rapid flu test, and I can see where we might even be doing flu test and COVID test at the same time.
That's what I'm wondering, especially
to-
even for primary care, that's what I'm wondering, is our primary care is going to be required to do both?
I
Just-
think they are,
yeah.
yeah. And I think they already are, because we've had a few cases already of flu
Oh, wow.
that I have heard from Murfreesboro Medical and some other clinics that I deal with. So we have seen a couple of cases of flu. There's a lot of strep throat going around right now, so.
Flu shot, is there a difference for me and the mayor and for somebody much younger?
Yes, there is a high-dose flu shot that's recommended after the 65th birthday. And for some people, it's recommended. I'll let you determine if you fall in that group. But there are some people who have lupus and other autoimmune diseases. And so they might take that shot earlier than the 65. And the reason is, as we age, our immune system doesn't build the immunity quite as well and quite as quick as it did when we were younger. And so that's why you get a little bit larger dose. And in the last couple of years, the health department has not had the senior dose available. So that would be something you need to get from your primary care doctor, unless this year we get some of it, and all to be determined yet. Should be knowing more in a couple of weeks.
All right, do we have any more questions for Ms. Garrett or her report? All right, if not, I'll entertain a motion.
Move to approve.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Chairman Allen.
Yes. Thank you. We appreciate you. Okay, community care report. Mayor or Carol, you have anything to share?
I've got it. Thank you, Madam Chairman. Members of the committee, everything seems to be good. Knock on some wood. That's real wood. Everything's been good out at community care. To date, since we shut down, we were one of the first in the county to shut down. I believe we were the first to shut down. As soon as the first case was identified with COVID, we've had no cases for our patients. We've had 2 cases from staff. And of course, they were sent home in quarantine, but we've been very, very fortunate. Still watching our protocol and being very careful. We're just thankful.
Really impressive. So
Yes.
we only have 2 cases.
Absolutely.
I'll entertain a motion to accept the community care report.
So moved.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Commissioner Gammon,
Yes.
Chairman Allen.
Yes. Very good. All right, Ms. Jolly, special projects report. This is just our tracker on construction spending, so you usually give us an update on kind of where we're at on that. Is there any changes from last month?
I've had some expenditures on the Tannance Elementary project. That's the biggest thing this month. But mostly it's just been paying I've only paid like 2 sets of bills maybe.
I knew you had quite a bit you added last month, so. I knew you said you'd had quite a bit you added last month, so. Very good. All right. Any questions for Ms. Jolly on the status of these projects? I'll entertain a motion.
Move to approve the report, Madam Chairman.
Thank you.
Second.
Very good.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Chairman Allen.
Yes. Very good. All right, school board. You said they're Zooming?
Yes, Mr. Rotary and Spurlock. We're supposed to, they got the Zoom links.
Okay. I don't see them.
He said he got them. 'cause
Okay.
Are we waiting for the school?
Yes.
All right, we're here.
Very good. All right, well, we didn't see you.
Good afternoon, first of all.
Awesome. Welcome.
We have 2 budget amendments, 2 for our capital projects amendments and 1 for the general purpose school funds. We can take the 2, do we want to take the 2 capital project amendments together, or we'll separate those?
Yes, I think we can take the 2 capital together.
All right, the first one is a capital project amendment where we are closing out and carrying over some funding. These projects that were allocated for the 2020-21 school year were not completed in time. Therefore, the funds are going to, from this fund balance, which is fund account 34,685, which is committed for these projects, will be rolled over to this year's budget for expenditures in the amount of $2,295,278.63 in funds to rebudget for the 2020-21 capital projects, school, Fund 177. The second one was a project that was allocated, the Daniel McKee Sewer Tie-In, which was approved for the 2019-2020 school year, but this project was held up. And we're requesting to take this funding for this project and amend this funding so that we can finish this project for this 2020-21 school year. So we got a motion to approve these 2 amendments as presented.
Commissioner Blair. Okay. All right, any questions for Mr. Spurlock?
Let me just ask a quick question, if you don't mind, Madam Chairman.
Yes.
I just wanted to know, both of those projects, the same money from both of those projects are just being rolled over from an identical line item to the following year. Is that correct? That is correct. Very good. Thank you. Thank you.
Yeah, we have there's a standard accounting practice where all open purchase orders get closed out and then reissued at the beginning of the next fiscal year. So that's what we're doing here. Okay, any more questions for Mr. Spurlock? If not, I'll entertain a motion on those 2 motions. Oh, I'm sorry, Commissioner Blair made a motion. Commissioner Gurley with a second. Very good.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Chairman Allen.
Yes, very good. You can proceed, Mr. Spurlock.
All right, this is the Fund 141, the General Purpose School Fund Amendment. This is just moving money to different accounts per the state. There is no amendment. This is not creating any more revenue or any more expenditures. This amendment moves $278,715 in already budgeted revenues and $1,108,028 in already budgeted expenditures. These accounts, the State Department of Education has asked us to use. And this amendment, like I said, has no additional revenue or expenditures.
Very good.
Motion to amend the 2021 general purpose school budget by moving the $278,750 in already budgeted revenues and the $1,108,028 in already budgeted expenditures to these accounts that were prescribed by the State Department of Education as presented.
Any questions on that motion?
Move to approve.
Good, thank you.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes. Very good. All right, Mr. Spurlock, you have anything else you want to share with this committee?
We are currently still holding about 20,000 kids are doing our distance learning. We're doing a lot better job. We had some parent meetings this morning where we trained them, and we're also doing it this afternoon at the Smyrna PD Center, or tonight actually, at the Smyrna PD Center in Smyrna. And we're excited to be back in school. We were very pleased with the amendment to the contact tracing and quarantine. It's provided us some opportunities to keep kids in school that may have been around someone who were possibly showing symptoms, but now it has been changed to someone who is confirmed to have COVID. So it's really helping us out a whole lot.
Very good. Very good. Anyone have any questions for Mr. Spurlock? All right. Very good. All right, we appreciate you, Mr. Spurlock. Keep up the good work.
Thank you.
Is there any other business before this committee? If not, we are adjourned. Thank you all.